Okay, I don't know what happened there. We'll see, we'll keep going. That's a bit hard to read, isn't it? You've got it on your notes, right? I think I made this look different. But what the point of this is that we were talking about where that negative emotional memory is stored in this little amygdala, right? And what we're looking in consult sometimes is to see whether the amygdala is hyperreactive or not. We're looking for startle.
Well done. Well done. You took that attentively, but
So see that?
little tester. Yeah.
And there'll always be something in your room that
Is it a
causes
virus?
worried animals
Yeah.
to startle.
And both of them.
So when you see startle, it's relevant.
So also
Relevant to what's going on in
it's
the
not his
brain.
fault. It's like
Tells you that
guy.
we're wired up to threat. So we're always looking for startle. Another example. Again, new space, right? But even in a new space, an adult dog should have enough experience of life not to look like this,
Body slamming.
right? Where we're worried about the mop, we're worried about the bucket, we're worried about the shelf,
To all those things. I mean,
and then watch here.
you know, it's just excessive. That's all
See?
excessive fearfulness.
Tiny little,
You know, you shouldn't really approach those
Startle.
benign things in that scaredy cat way, right?
yeah, not my current
Even though he
room,
doesn't know his space.
but this is one of my
Our normal
previous
dog comes in.
spaces. Often we want, obviously with behaviour, good behaviour is time and space. Lots of space. Clearly those videos that you see where I'm consulting downstairs is a nightmare because a tiny little consult room is the worst thing for behaviour. The bigger the space, the more the animal can move away from you, the more you can see, you know, what the animal chooses to do, the safer it is for you. But also time, you know, time is you need a lot of time to do good behaviour. And a lot of information.
Yeah, okay.
So this is the current space. Again,
This as well, like the flag.
so there's a flag
And
that's
she's
outside
worried
that's
about that. And if you're an
purposefully put
abnormal
there
dog,
to
you'll worry
see
about that
startle.
flag. I mean, I don't need to have her worry about that
So you
flag.
can see she
It's
hasn't
so
eaten,
obvious,
which
but
is obviously
anyway, sometimes, you know, the spook at
sign
the
of
flag is
stress.
the thing that we see that
What other stress signs do you
tells
see
us
here?
the dog is abnormal. Right, so what we're going
Tail
to do,
tuck.
so yeah.
So there, see
We've
that
got the
started
tail
there?
tuck, we had the balking on entry, we have the not eating, we have the startle,
Yes.
so the strong startle.
Yes.
So
Do I like
Again.
to pick out what I'm seeing for the client?
it tells us what's going on in the brain,
Look at this.
because startle is the amygdala response, that threat processing in the reactive brain firing off. And actually every time it fires like that, it makes her more reactive. So, okay, we've got whining, we've got panting,
There we go, big stress yawn.
we've got stress yawn.
I mean, you know, some people will say, oh, well, it's a foreign environment. Wouldn't a dog normally be stressed? Well, no, not if you're a calm, relaxed dog. You go into a new environment. This does not feel like a vet clinic. Very purposefully is not like a vet clinic. Has no smells of a vet clinic, has no visuals like a vet clinic. So it should be a new space, but you, with the length of consult that we have, a normal dog will lie down in a new space within 10 to 20 minutes, right? If we're in there for an hour and a half, and they never lie down, we're in big trouble, right? So we're looking at the time it takes to acclimatise, what kind of stress signs we have.
Yeah.
So she's watching the
So
flag.
if you're a normal brain, you kind of watch the flag and you go, oh, yeah, that's a flag. I'm not going to worry about it now. You know, like, normal sensitivity is such that you can evaluate your environment and go, okay, there's a shake off. So again, that's a stress sign. Right,
So the dog is doing
what can I
great,
do to
following
calm
the
myself
textbook,
down?
isn't it? Giving us lots of information.
Normal brain sensitivity would be that you can take in a lot of your environment and decide.
Well, so there's some banging outside, and
Decide what is.
that's
well,
pretty
like
loud
the
banging.
Flag.
But still, it's still excessive startle, right? Yeah. But this is another interim space, so I am building a building which won't have so many triggers to it. Although, you know, you want to have a trigger so that you can look at, okay, only dogs that are worried will worry about this. Something. You don't want to have it so benign that even the most anxious dog feels calm there, in a way. So you want to see you want to see something. But currently, the current space is way too noisy. And it does feel too triggering, actually. I don't want that. And I mean, obviously down here, I mean, actually, loads of vet behaviourists do consult out of inappropriate spaces for the job because they're often associated with university vet clinics, and they're not for vet behaviour. But you know, our new space is going to have, you know, the consult area is at least as big as this room, which is of course much bigger than any consult room. It's in, you know, you need a human-sized space to talk to the humans, and then you need a dog-sized space to deal with the dog. We also have a safe space where we put very aggressive dogs that we don't want free around us in the safe space, and consult outside of that space. So the amygdala, lots of inputs in, and what's interesting about this is that things that go through the nose hit the amygdala without going to other brain areas first. So this is why you have that emotional resonance around smell, right? Is there any particular, you know, childhood smells that make you go, oh wow, that's great, you know? That is because it's much more emotionally resonant to you than a picture, right? Because with a picture, it doesn't hit your amygdala without going through other areas of the brain first that process that. This is why if you're a real estate person, you put the coffee pot on when they come in through looking at the house, you know, bake bread, well, they bake bread or something, you know, like they do things to actually trigger that emotional memory for people. Oh, just at my grandma's house. Or whatever, right? So, with that in mind, what is being remembered here?
We can do the same thing. Why don't we do it in the leg also, and that way you can hold her in your lap also.
So this is a future anti-vaxxer, right? This is like a COVID denier being in the making. Strong emotional memory around vaccination and learning how to vaccination. We've got the social contagion of the little brother. Failed vaccine, got to do it again, standard trauma over and over. But you know, these kind of things, you don't want this to be your puppy vaccine, right? You want that puppy vaccine to be head down in the cat food, slide a little 25 gauge needle under the skin, you know, nothing. No negative reactions, as much as possible. Okay, so the emotional lives of dogs, they're a 2.5-year-old child, always, not very thinky, quite emotional, quite tantrumy, but still strong emotional lives, but not where you know what the other was thinking or worried about what the other was thinking and therefore feel differently. So that's why guilt, shame, those things, they're not things that dogs feel. I'm so ashamed I ate that poo. They don't think that, do they? They just think poo, yum. They don't think, I'm so guilty, I really peed on the carpet. They don't think that. So, you know, humans will of course see the appeasement, see the sorry. They will interpret that as guilty. And I don't have any good ways of teaching you how to instruct clients that they are not guilty, because they absolutely hang on to that solidly. And you can say, well, look, there's experiments where they haven't done anything, and if you go in there and go, what did you do? They still look guilty, right? So it's very effective appeasement for the human anger is what it is. So any dog that you actually see do the guilty look, because they do it in consult when they interact with their owner, you know that owner has verbally reprimanded the dog.
So it's just like a reaction to the conditioning, right? They're like, they see the scenario and they're like, oh shit.
Oh, yeah, oh, we'll be in trouble. It's good reading of humans is what it is. So often, all dogs in animal sense get a adaptable bandana placed upon them by the owner about halfway through the consult to see if they're adaptable responsive. And it's at that moment when I ask the owner to put the adaptable collar on, adaptable bandana, I see the guilty dog. They call the dog to them and they're not like that with me. So because they don't have that relationship with me. So if handling has been forced on them, or they're, being called to the owner means I'm going to get in trouble, which is a lot of stuff, you see them. Oh God, here we go. They go, but they're like, ears back, right? I just, it's normal. It's normal for humans to be punishing, even good humans. It's in our DNA. So this area here, this hippocampus, is what is being damaged by the overreactive amygdala. This is damaging the hippocampus by cortisol. These are the type of injectors you will be.
Let's do mine. 1, 2, ready. 1, 2, ready.
Joyful.
Good. Daddy's got your arms whoa, we don't like this. Was it a 1, a 2, hooray?
Fast injector.
All right. Is it a 1, a 2, hooray?
Skilled.
Good, yes.
Then if there is any discomfort, we need to change the discomfort into joy.
All right, let's get your Band-Aid. Hold on to that. Good. We'll get your Band-Aids. What's that? Let's get this one on. You're going to take it right off. I know you guys. You take them right off. What they do is say, good. All right, clean up, clean up. Everybody do this here. Clean up.
Okay, so obviously this is one way of describing fear, anxiety, or pain. Avoidance, we actually don't mind these dogs as much, right? Because they're not going to get in our face. These ones we worry about, the ones that are going to actively drive us away. Okay, that's more risky for them. The appeasers we often incorrectly assume are very friendly and exuberant dogs. Again, try and unpick this a bit, because an overly appeasing individual is actually, I call them frantic friend makers. So they're trying to be, they're apologizing excessively. Just imagine yourself in that scenario. Sorry, like me, sorry. Oh, I'm buying you lots of presents and I mean, we don't like those people, do we? We tend to kind of like go, oof, sickly, right? But there are people out there that are overly trying to create, good feelings in others because they're what? Underconfident, right? Anxious about the social interaction or whatever, right? So they're the frantic friend makers. I think of them like myself when I've had too many wines. You're in a social situation, you have too many white wines, and then you're like, oof. And then there's these ones, right? The inhibited. So these ones are the ones that we monster, I suppose. They'll be the ones that the client says, oh, he's fine. So whenever someone says, oh, you can take him out the back, he's fine with it. Just, is he? Or is he just like inhibited and frozen? So your greyhound, he doesn't eat, right? But he's just fine. So inhibited, this dog has got a no dogs lead on and is at the cafe, and oh, he's so good, isn't he? He's so good. Well, he's like frozen in a like, oh my God. So they're the ones that kind of we worry about their welfare somewhat, because might be the dogs that are being used sometimes as companion dogs or therapy dogs that are overwhelmed. People are monstering them all day long. They're just fine with it. This is in an adoption centre. Again, on Facebook, it was described as lovingly gazing in the man's eyes. Too stiff, too still, too close, uncomfortable. It irks us, right? Because we know that this is not a happy dog. This is a so good. You'll feel it, good. Because you should
so tense.
Because you should trust that feeling. That's good. You should trust your feelings that you go, oh, I don't like that interaction. this is a veterinarian. Don't do this. You don't need to kiss your patients to show them that you're, you know. What's wrong with this scenario as well? Yeah, I mean, why are we doing the dog on the floor? Why are we on the table? Why are we on a table with no, you know, non-slip? And then, yeah, we're not recognising the stress signs here. Tight face, panting, ears back, startled. So, you know, I don't know why they put this on the internet as this was, look how lovely, you know, our interactions are with the dog, right? But, you know, this, you'll see this all the time. I mean, I can't bear reading the Dogs Refuge Home, you know, pictures. Because they all look, they talk about, there was these dogs the other day doing these submissive grins and stuff. Look at his smile, look at his smile. You know, like, that's bad anthropomorphism, you know? Okay, this is not unobvious, although it starts out with a bit of conflict of signs. So, we're not eating, we're panting, we're stress yawns. Now we hard stare, close mouth, and now we come. So I say, I don't know what that was about. I actually think I probably gave him the eyeball, you know, which I'm not as unskilled as I was then at knowing when not to look at a dog. But what I like about it for you guys is clearly you can go from avoiding and, you know, just showing lots of stress signs, but if you're tethered, or this dog was tethered because it had a history of actually lunging, obviously when you feel that you're not, it's not working for you, you can flip to the other, another way. So avoiding's not working for this dog. I can't get out, I'm looking, I'm stressing, you know, I actually really, it's her that I really want out of my space. So there. So actually when you see the hard stare, it's more a sense of feeling it. Again, like you felt it before when you, yeah.
That's just funny.
That's okay. When you feel the hard stare, it's literally too late. I would say he's coming, right? because I think, you know, that split second, in that split second, and that's why the video is so great, because you can look back. Because I think at the time, I was like, gee, I didn't see that coming. But when you look back at the video, you see it, don't you? Before it happened. Yeah. The rule there, I suppose, is that obviously if you have enough history, certainly you make it safe first. So in those scenarios, that's why dogs were on a tether. I wouldn't do that now. I would put it in the safe space, because being on tether is not a great way to feel for the dog. So in a safe space, we have a safe 3 metre by 3 metre space, so like a corner of here, where we put them, and we're outside of the safe space.
Is it like just friends or something?
Yeah, so like a pen. Because then they can be unmuzzled, untethered, free to move around, free to eat, but actually not get to us. Because it's actually quite nerve-wracking to have to do a consult, which are long, in the presence of something that's aggressing towards you. It really gets you cortisol up. So you don't really, that's not the aim either, obviously. The aim is not to make too much aggression happen. So when you see these kind of images on the internet, you do wonder how evolved the person is, don't you? Because this shouldn't be something that a human thinks is funny. Like, it's just not funny. But there's a lot of that out there. So I don't know what's happened to humans. Humans don't get that growling is scary sometimes. But really, that shouldn't have to be taught. That is an innate human skill. That should get your heart rate up, right? So when people say, "Oh, he just does this is," like, they're not. Nah, they don't. I don't think dogs fake it like that. I don't think you should see a dog growling and go, "Oh, he's just does that as fun." No, he doesn't. So frantic friend maker. Staffy. Yep. You got it. So Staffy, this is an hour into a consult and we're still on super speed. So what that means is that we'll crocodile roll, we'll expose our genitals, and then we also want to smell yours. They want to get up in your face, they want your orifices, that's where the information is. And they're really keen on connecting with your face. They're licky, they're mouthy, they're rolly, all of those things in this, and this can easily be, "Oh, he's so happy." But do you see how this is not happy? So even these people, you've had like 5 staffies. So they're kind of, their baseline is like, it was over here anyway. They thought, "Oh, he's not good." But, a lot of staffy owners normalise a level of this, don't they? "Oh, he loves me, loves. It's all love. So it can be a little hard for them. Well, these people were clearly having a consult for it, but like if you're having a GP consult and maybe dealing with other issues and you think, "Oh, she's a frantic homemaker," but that client hasn't come in for that, they may not be open to that idea that their dog is abnormal. They can think this is completely normal. Don't you reckon? And I've argued even with some vet students over it, None of you are arguing with me, but sometimes the vet student will be in that group who says, "Well, that's just normal, isn't it? That's normal having dogs." So yeah, it gets. I don't think so. I think that is abnormal level. Because I guess as well in behaviour, we're always trying to promote a calmer being. Partly because emotional capacity your sink of emotional capacity, which is your genetic makeup, can overflow with good or bad or both. But either way, you can be emotionally over it. So even if this felt good for the dog, which I don't think it does, it could be too much of a good thing.
Especially after an hour.
Yeah, exactly.
If it was doing that the whole time.
Exactly. Another Cocker Spaniel for you. I'm gonna turn you off Cocker Spaniels by the end of today, even with their lovely ears. Right? So this is a client in Townsville. That's why he's always half naked. Now this is his dog. So look at this interaction. Would you feel good about this with your own dog?
Look behind you. Look behind you.
He's growling. So Patty growling, deep growling, deep growling. Suspicion, moving away, growling around the man. Other dog, okay. What can you see here?
Alfie, go.
See here?
Hey, come here. Come on. Come on. Come here. Come on.
Can you see that? Shot collar?
No. Stay.
So he pursues the man. It's quite offensive. Wearing a shock collar. Very wedded to the shock collar, unfortunately, by the time I meet them. They say he's worse without the shock collar. But do you think the shock collar is helping us? What's happening? I mean, he's getting shocked on growling and barking at the man, I suspect. Especially if it's depending on what it's set at. But so he's making an association with his dislike of the man with pain in his neck as well. I mean, this was a world of pain. Another one, you know, where again this doesn't happen overnight. This has been going on for some years. See the confusing signals that the man gives the dog as well? No, stay, go. All over the shop. Again, when you're looking at these videos, you want to be asking yourself, or say the client's describing it, what is the dog's motivation? I mean, nearly always you'll come up with the answer, the dog is just trying to make himself feel safe. Actually, there's a need to control the environment. And, you know, animals do, and humans do, what works best. So, if we want to give the dog more safety and control, nearly always the first point of call is to change what the human is doing. I wanted this man to then wear a treat belt, and as he's moving around the home, he is rewarding Alfie. So again, no free food in a bowl, nothing down. And sometimes, you know, we've got multi-dog household, right? So, you know, would we even for a period of time get rid of one dog in terms of letting it stay somewhere else, because we don't want the other dog just eating all the food. But we have to make the man a good thing. I've got another one like this only last week. You know, he's FIFO. They're just newly, well, not newly married. They've had a baby, so they've got a 3-month-old baby. They haven't been together that long. She already had the dog, the poodle, already anxious. Then he comes into her life, and the dog hates him. Barking like this at him, following him around, pursuing him. Doesn't bite him. comes in close proximity, he is over it. So he's ignoring the dog, not doing anything, it's following him, it's barking, he's going, oh, that will never get better. He has to then change his emotional state to be able to reward the dog around him all the time, and she has to be zero source of food. So that is what you do here as well, right? Is you would, because there's a mother and a baby in the house here as well. And interestingly, actually it's not that uncommon. If he's there in the house on his own, the dog doesn't do it. So this is how sometimes people start to think that the dog is protecting the woman and child from the man. I'm not so much of a believer that that's what's happening. I think the dog is more able to show his emotional state when the woman's there. Because the other couple, similarly, if he's there on his own, the dog doesn't follow him around barking. It goes to the farthest corner of the yard and hides there. So actually, if he's on his own, he can't interact at all with the dog because the dog avoids him. With this man, if he's on his own, the dog is fine.
That's strange.
It is very strange. And you know what? The more I do this, the more I realise that, you know, you see things that you've never seen before quite a lot. And I've been doing this for quite a long time now, and I go, never seen that before. There was a dog that was going outside and barking at the moon, which I actually think I have seen before.
Oh, I've seen that.
But you know, like certain fears and things that you've never seen before, and then suddenly you'll see a couple together. So sometimes I think this can be really useful cartoon for people, because it explains that the offensive dog that you see there in the red was once a little fearful, timid, avoiding animal. Because it's very hard to look at Alfie or Panda or any of those dogs and think, you're frightened, you're doing this because you're frightened. Because they look so confident in their pursuit. But nearly always if you go back far enough, you find that they're not. So that's why I think it's important, because it is just a strategy change. And you know, you might see, this is a classic actually, you know, oh, whenever someone comes in, he lies down for a belly rub. Well, just check that that's not a tap out where we go, oh, I give up. So they do look different. Obviously a belly rub that you're happy about, your body is soft, your tail is loose, your legs are open. Whereas a submissive roll, see the tail tuck? And we're a little bit whale lie, and we're like, might be lip licking, and like actually, and then the human still goes in for the rub, which does not help.
What about the peen? Is
Yeah.
that like in the fearful?
Yeah, the submissive pee
Yeah.
on greeting, yeah, that's a
Like
red flag
release,
too.
yeah.
Because that will usually go away, but if that's in the history that you were a puppy that submissive peed or peed on greeting,
Yeah. I know adult dogs, it's still,
yeah,
no.
I think
It's
it's a
like-
worry sign for sure.
I have a question.
Yeah.
So are we sort of saying if we notice these sort of hiding fearful behaviours,
Mhm.
we should, and if we see it in a consult, we shouldn't like try and push for the consult, obviously. and tell them to come back, or like how do you?
So okay, so you're in a GP consult and you see that your client is fearful and concerned.
Yeah.
How do you proceed
Yeah.
with the consult?
Yeah.
Well, I guess it depends. I mean, you know, if it's something that you can do minimal handling with, and you know, obviously you need to do, well, depending on what the issue is that they've come in for.
Yeah.
You know, if it's a skin consult, you know, are you able to do some of it? Are you able then to suggest some pre-vets medication for next time? You know, I mean, I see a lot of Mandy's derm clients, right, as well as them going to her. They'll come to us because they're recognised as anxious and they have to have a lot of derm consults, and we're part of the derm plan because we're dealing with the anxiousness or something. So, I mean, you know, often if it's obviously a health issue that needs to be done,
Yeah.
then you're going to find a way to do it with sedation
Yeah.
on board or whatever. But you know, if it's just a consult about vaccination or something like that, then you could open up those avenues. Start to say, oh, it seems to be really. We talked about that actually last time. I did talk to the students like when I was in general practice. Last time I was in general practice, a long time ago now, probably. Right at the end of my general practice career, I had started doing a 10-question behaviour wellness thing that they would fill out while waiting for the consult. So for a vaccination, it would say something like, is your dog worried around unfamiliar people? Is your dog worried around storm and noise? Is your dog worried home alone? Is your dog, so it'd be yes and no. And if they answered yes to any of those questions, theoretically, there might be something that requires further input about behaviour. Is your dog barking home alone? Is your dog happy around strangers? I don't know. You know, easy questions to answer. If they can tick no, no issues to any of those, then they're probably a pretty okay individual, right? I guess the other thing about behaviour is if it's not a problem for the human, you're not going to get them to go through all the work of a behaviour consult. It has to really be front of their mind. And obviously, I think we've probably said this in fourth year, destruction is a big problem for the human. So separation anxiety where there's destruction will get a Guernsey. Separation anxiety that is not causing complaints or is not seen or is silent or is, that's just going to go under the radar. And again, that's why the inhibited and shut down individual doesn't get the help it needs. But is it a welfare concern? Probably. So really the ones we see are the ones that cause the most issues for the humans. The aggression, the destruction, the barking. I can't walk him. But my clients are highly motivated by wanting to do the best either for the animal or really need to solve the problem for themselves. But you're not going to have the glory of all of those. So the stressed brain, you see the physiological arousal. So you've got stress signs that you can see, barking that you can hear. The stressor is perceived as aversive for the dog. So that doesn't mean that, when the client says, I don't understand why he doesn't like Uncle Joe, he's really lovely. Well, he's a stressor. And then the animal feels no control or predictability. So this little 3-part thing actually tells you what you need to do. You need to decrease the physiological response. You have to change the stressor from being aversive to good. And you have to give the dog predictability and control. That's your plan, right? And actually that's your plan for yourself as well. If you have any stresses in your life, the more predictability and control you have around those things, the better you feel, right? You know that. You know when you've got your exams coming up, and if you write yourself a little list, I'm going to do this on this day, this on this day, and suddenly like, I feel really good now because you've made it predictable. Imagine if you knew you had your exams and no one's going to tell you what days they're happening. Next week's exams, and you know what, it could just happen at any point in time. You know, like that would be like highly stressful, right? So you just think about for dogs when they don't have control over their lives, because we do, right? But if we don't give them the signals that know that they, you know, they can then predict what's going to happen. That's why good obedience, even though this is mental health, good obedience can actually give the dogs predictability. And that's why we so highly recommend that we are using cues that the dog understands, that we're using markers that mean food is coming. You know, we're trying to make ourselves really consistent. You know, we try and take away all the verbal punishment, all the reprimand, all the human inconsistencies that are really stressing the dogs, right? So now we're getting down to how the meds are going to start working, right? Because we've talked about stress, we know what that looks like, and what it's doing to the brain is damaging the learning and memory, right? Stress. So we actually want to reduce the stress on the brain because it's actually damaging the ability to think and be calm. So how we're going to do that is by actively changing neurotransmitter levels in the brain. And the neurotransmitter that we're most interested in is serotonin. Noradrenaline sometimes. Glutamate is the major excitatory chemical, and we often see that that's in too much supply, obviously in hyper-aroused individuals. And so sometimes we want to balance that out, and we could do that by elevating GABA. We have no current way of elevating oxytocin centrally, do we? But you know, in pigs, right, they're giving the intranasal oxytocin to make the mothering better, right? Yeah. That'll be a new thing somewhere in your future. I'll be dead, probably. Oh well, you'll be able to go, oh, Nicole, remember Nicole? She said one day this would happen.
Ads release oxytocin?
What?
I mean, not for a dog, but human to human, there's ads release oxytocin.
Yes. And that's what happens when you look at your dog. You get oxytocin release in your brain. Yes. Orgasms, sneezing. So apparently, one of the students told me that. They were probably pulling my leg. They said 1/16 of an orgasm was a sneeze or something. You're making that up. I don't know. Someone could Google it. But anyway, definitely, yes, when you engage eye to eye with a loved one, you get oxytocin release, and that could be hugging. And that, you know, women breastfeeding the baby, and the baby, that their vision is from breast to face. That's how far they can focus when they're that old. And both oxytocin is being released baby and the mother at that point. But there is, there is no way to give an animal oxytocin and have it act here centrally. So when we give it, right, when they're giving birth, it does stuff to the uterus, right? But we're not getting it centrally. But if we could get it centrally, and that's where this work is being devised to give it through the nose, because it doesn't cross the blood-brain barrier or something, right? So if you give it intranasally, theoretically you could improve mothering and you could improve social feelings. I think that could be a big thing. Someone could research that.
It just needs to be bound to something that crosses the blood-brain barrier.
I guess. I don't know why would that be so hard to do. But there's pharmacology that I don't get there. Right, so that's good. That's the end of that one. So let's go over to part 3, which is part 3. Oh, it's all working so well currently.
Wait, part 3 or part 2?
Part 3. Yeah, part 2 we started. Yeah. So this is the chemical we most care about, right? Serotonin. It is the one that balances mood. So I like to think about it. I'm not going to go into too much detail about it when I'm talking to clients, except to say serotonin is the neurotransmitter that when we elevate it, we're going to protect the brain from stress and allow better learning. This is why it's slow. It's going to take 6 to 8 weeks on an SSRI for you to start to see the positive change in the dog. But the serotonin pathways are the pathways between your reactive brain, so remember our amygdala, and our frontal cortex. Remember our thinking brain? So if we want strong connections between amygdala and frontal cortex, we don't want a dirty little track. We want 5-lane highway, back and forth, stopping Henry, hitting the man on the road rage when he's pulling in frontal. He has lots of serotonin pathways. Okay, so if we have lots of serotonin in the system, what architecturally happens is that we start to make more pathways between those areas. So it's kind of subtle, right? This is not going to change Alfie in tomorrow, or Panda. Bite event could still happen. All of these animals that we've been looking at, for instance, if we just put them on an SSRI, they're still going to bite their owner tomorrow, right? So even though we do want to do that, and often it's the baseline, we are starting an SSRI. Most of the animals that come in with high level aggressive damaging behaviours are going to need something that works quicker than that as well. So we're going to talk about that. But we are interested in serotonin as a major brain changer. So, you need to know potentially more than one SSRI. We commonly use about 4 of them. So fluoxetine is the oldest and most common. Also has the most side effects, so that is just by the way. Paroxetine, another human SSRI, similar size tablet to fluoxetine, so could be swapped over. Sertraline, bigger tablet, less side effects, more modern. Then there's fluvoxamine that we use. We're going to talk about
trazodone, but that is not a SSRI. It's a serotonin antagonist reuptake inhibitor. Then there's clomipramine, which is a tricyclic antidepressant, which is very biased towards serotonin. And GABA does affect blood levels of serotonin, even though that's not its major effect. Its major effect is on GABA. We're just going to skip past this chart for a minute and go to this one. Ooh. Which in my other slide has got some red on it, which helps. But anyway, so the one you got in your notes got red on it? Yeah, oh, good. So I have in your notes, I've highlighted the drugs we like, right? And the reason being is because they are the least anticholinergic. That's a side effect that we don't want. We don't want to dry up secretions, right? That could make you constipated. We want the least hypertensive ones because we don't want to drop blood pressure. We mainly want the least sedating because clients don't want the dog to be sedated. We want the least antihistaminic, but the most serotonergic, the least adrenergic, and the lowest seizure potential. So see how this chart can help you with your choices? If there's something you really want, like I actually really want to sedate the bejesus out of this dog, well then, okay, the most sedating is amitriptyline. But amitriptyline, which is Endex, which is a tricyclic antidepressant. Maybe it's a very old drug, and to be frank, we don't use it much. But it is the most sedating, and it also is antihistaminic. So there might be some conditions that it suits, like I'm chewing my leg off, you know. But in general, see the ones that I've put in red there? They're the ones that fit mainly the conditions we want with the least side effects. And that chart there is in Landsberg's book. If we go back or forth, or I don't know where you are in your notes, but this is why behaviour is so easy, right? We only have 1, 2, 3, 4, 5, 6 really commonly used meds that we fiddle around with all the time. So you understand you've got to pick your baseline, but you also need something to deal with the dog that's in front of you. So here's where I don't really care too much about your diagnosis. I don't care whether you call it fear aggression, impulse control aggression, protective aggression, territorial aggression. I don't care about that, to be honest. This is one of those areas where diagnosis is not as important as treating what you see. Okay? So, Alfie or Panda, we need something there to drop the arousal, right? Because we're barking and we're agitated and we need it to work in the dose. So you've got different choices for the adjunct. Say we've got, so on the side there we've got the benzo, clonidine, trazodone and GABA. So we're going to go through each of these and then you're going to get a sense of when you would use one or the other or both or more than one. Obviously, or maybe it's not obvious, but I'm going to tell you, the SSR, you choose the SSRI or a tricyclic. You don't have both of those. They're one or the other. They're your serotonin, right? You're not going crazy and going, oh, I'm going to put him on clomipramine and fluoxetine and maybe sertraline. You know, you choose one of those. But with your adjunct, you are thinking, okay, what do I need? Do you remember with your benzodiazepine? Remember how they work? What neurotransmitter are they? Very good. Very good. Where was that? Prize for you. Virtual. You know, just imagine you go and prize. Yay for you. Right. Yes, GABA. Right. Drunk. Remember? Too many white lines. That's how you feel. GABA. So you can be punch drunk, you can be a lovey drunk. You know, so if that a happy drunk or I'm a disinhibited and I'm gonna fight you. So you're just a little bit aware, right, that your benzodiazepine can be a little bit unpredictable, but it is a good anti-panic, quite a strong med.
Is panseolytic antipanic?
Panseolytic is anti-panic, yes. Isn't it a great word?
Yeah. So I was like, is it anxiolytic? But that's just
Yeah, it's a panseolytic. It's just a little bit clever. Panseolysis. And it does block the molecular laydown of memory. So you have your benzodiazepine and you forget what happened while it's working. So you've got to think, you know, if you really think that this is going to be an aversive thing, you can use some benzodiazepine for a vet visit, right? That you're going to, you know, when people go and dislocate their shoulder or their elbow or whatever, and they go to the emergency room and the doctor gives them midazolam and then puts their shoulder back in, and then they have no memory of it and it hurt like hell, right? Humans, they do that with humans much more than they do with dogs, thankfully. But you know, like you can have a benzodiazepine and be effectively have that wiped out of your memory. So useful maybe as a strong intermittent use med. But you know, do we really want that for Alfie or Panda? No, not really, because you know there's also the side effects of like, oh, we might actually make him very hungry. Oh, I don't know if I want to make Panda really hungry. He's going to rip his bloody arm off, right?
And would you have no like use of the positive associations that you're doing?
Yes, potentially no ability to learn under the influence. So here's a dog having a benzodiazepine trial, and this dog's going to have it for vet visits. So we actually quite like to promote eating if we're going to use it for a handling vet visit, because it might promote, and it does in this dog, promote the use of the licky mat. But here it is drinking a lot, again under the influence of the benzodiazepine, so you might want to remove the water. But what we're looking for is that we're staggering and prone to sleep. We don't want to see an agitated, so you're going to see a bit of drunky. So staggery and a little bit scuffy on our feet.
Go on, go sniff.
There's a very big dose range, remember? 10-fold. So it takes a little trialing sometimes to find out when you're sick with the benzo. The Xanax
Good girl. Good
is
walking.
an S8,
Come on.
meaning when it's S8,
Good girl.
humans will abuse it.
Careful on the flippy floor.
You can't write repeats on an S8
Here.
if you script it.
Come here,
You
sweetheart.
can only
Come on. On
give
your
them a
bed,
certain
darling.
amount.
Good girl. Okay, lie down. No, that's cheeky. Lie down.
Good girl. You're welcome.
Yeah, the S8 is only Xanax, and there are many other benzodiazepines that are not S8. So you can avoid the S8 one if you want. But the S8 one, unfortunately, is one that we quite like because it only takes half an hour to kick in. It'll last for 4 hours. It's kind of nice. But it does have that difficulty. So, it's not something that I don't know about Zoe, but I certainly don't use it that much. I don't think that Zoe uses them that much either. They're not that reliable. Like you and it also, if the dog's been made worse on one benzo, the client is really not that keen to try another, even though it doesn't mean that the other will be the same. But I did have one the other day where the dog was really, so what had happened, it used to be a 2-dog house and they split and they took 1 dog each, couple. And so the dog and the man took the dog that was more anxious, and he's a boilermaker, or I don't know what he is, but he's away a lot, like 12-hour days. The dog was beside itself with separation distress, and there was no way he was changing his management. And it responded beautifully to lorazepam, which takes about an hour to work and lasts about 8 hours. So, but in general, it's not something I reach to that often. Trazodone is something that you will have seen in the vet clinic probably for cage confinement, post-operatively and things like that. And again, it's not reliable in your anxious dog as always going to be calming. Unfortunately, in behaviour, it's always this way, where you're saying, oh well, we're just going to give it a go, but we don't know. Because individual reactions are quite common, where I vomit, I don't respond at all, I feel woozy and I don't like that, and so I'm worse. You just, in a way, you have to give the clients the advice that you can see anything. This is what I'm hoping to see, but if you see anything you don't like, you just stop the drug and you tell me. Mainly, say in the hospital here, when they use trazodone and it works well, it's because they're not actually that anxious. And it's just a bit of sedating. Because if you're truly anxious, trazodone, in my opinion, is not that reliable. It's also very expensive, so we wouldn't use it as our source of serotonin, not like an SSRI, because an SSRI is cheap. Think you're going to have these dogs on meds for years. You're not going to use a med that's a couple of dollars a day, right, as your maintenance. So trazodone is a intermittent use med, probably for, again, do I look at Alfie and Panda and go, I'm going to give you some trazodone? I don't think it's strong enough. Okay, but it's there, and it's possible as a choice, and it's possible to use it and be on your SSRI, but just don't go crazy. So I get a lot of GP vets asking me, can I have the dog on trazodone when it's already on an SSRI? Yes, you can, but just don't go over 8 to 10 milligrams per kilo, right?
This is the med that when I see Alfie or Panda, I think you need some clonidine. So you might not have heard of this med yet, but clonidine is similar in class to medetomidine. Okay, you know that? And in the States you have a lovely med called Celio that we don't have here, which is a transmucosal alpha-2 agonist for storms. And they use it for vet visits, so it's actually, we don't have that. I don't know if we'll ever get it, but you can imagine, you know how effective it is when you dom-tor the dog, right? You've seen it, everybody, right? So the domator aspect, this is an oral version of that. Think of it like that. So in humans now, this began as a blood pressure med for humans. It's not very good at that. And it's not good at that at all in dogs, which is good because we use it at very high doses. Doses that would send a person fainting. Okay? In humans though, your psychiatrist is giving you this when your bridge collapses, right? It's for post-traumatic stress disorder. It's for panic, phobia. They use it for coming off your methamphetamine. They use it for ADHD children. They use it for menopause in women. They use it for a load of stuff, right? So, at very low doses in humans. So, it can be shocking to the chemist when you write your dog script, just saying, they think you're killing something, because the doses that dogs take is much, much higher. But, you know, you can end up with some urinary incontinence if you go up there. I have done that. And then obviously you'd need to pull back. You usually start low and you titrate up to about the mid dose on a larger dog and maybe at a higher dose on a smaller dog. So to give you an idea of what it looks like, so this is Cuda with no clonidine. Cuda is, again, suffering physiological arousal, barking, hackles, growling. I'm often using clonidine where I see a lot of physiological arousal because this is dialing down adrenaline release in the brain. So it means you cannot mount that flight and fight, right? So when I'm describing it to clients, that's exactly what I'm saying. I'm saying I'm going to turn down the flight and fight. So here on the clonidine, we're like,
Does it actually reduce anxiety or is it more sedating?
well, humans report that they don't feel the panic because your heart rate is slowed down, your palms are no longer sweating. So you are more able to cognitively look at the scary thing and go, uh-huh, not so bad. So there was an American student once in class who had clonidine for fear of flying, and she had 5 flights and she was cured. So I guess what we think about, and who knows that we can extrapolate this to dogs, but say you have dog reactivity where you are in flight and fight when you see other dogs 20, 30 metres away, right? And I give you clonidine ahead of your walks and you see dogs 20, 30 metres away but you don't feel that physiological panic and you now can look at your owner and take food, then my theory is that you are then able to learn, see dog take chicken, move away. See dog take chicken, move away. And you can you have memory of that. You can make more associations with that. So the lowering of the arousal just puts you in a better place to learn. The thing about it, when it works, clients are like, oh my God, they're in love with it, right? But I try and make sure they understand that it's not a brain changer in the way that the SSRI is. We still need and we still want to find the SSRI that is showing us that we start to no longer need the clonidine to manage the arousal. You see what I mean? Although, having said that, we have some dogs that are on clonidine for years, along with the SSRI, if that's what works, right? We don't always get off the clonidine.
So are you just trialing at this point? Like you think, oh, dog's doing well, they're doing a lot of positive reinforcement, seems like it's doing okay, let's try stopping the clonidine.
Yeah, so if the clonidine had been, so the clonidine could be being used both intermittently, maybe I only use it once a week, or I could be using it twice a day, every day. So again, it depends on the level of trigger. Say I'm really triggered by a lot of shit outside my home, and I'm barking my head off all day, every day, you might be on a clonidine consistently while we wait for our SSRI to work and then slowly maybe drop the dose of clonidine as opposed to just stopping it. But if I'm having it intermittently, I might use it for a while and then, you know, what happens is 6 months down the track where the people were using it for every walk, they now don't need it on any walk. So yeah, there's a lot of flexibility with how you would be using it in conjunction with talking to the owner about how they want to use it. So it's not quick to come on, like it's a 2-hour med, really. So if, for instance, they say it's dog reactivity and they are wedded to a 6:30 a.m. walk, well, are you going to get up at 4:30 and medicate the dog before you walk at 6:30? No. So it's not going to be useful for that walk. Are we going to change when you walk? Maybe we're going to do that so that you can use it ahead of the walk. It's actually pretty hard to get people to change some of these things, especially, you know, when it's how they do it and they want to keep doing it that way. But you know, like so sometimes if they don't understand how the med's working and they're giving the clonidine when they come home from the walk and then the dog's just sleeping all day, well, I don't know if that's really how we wanted it to work. So you need a lot of discussion around, I mean, something like Panda and Alfie are both dogs where I would think I would give my clonidine as soon as I woke up in the morning, and again 8 hours later. I don't want that dog not having the benefit of the clonidine over the whole awake period.
About 3 hours.
Yeah, about. And sometimes I'll even make a slow release version, still giving it 8 hourly, but I don't want any dipping. Boom.
Is that just compounded?
Yeah, but I go to a special
Drug guy.
I'm not giving you all my secrets, but you know, there is things you can do, but
But, you know, certainly as a fairly reliable med, it won't be every time. You'll still get the failures where they go, oh, I tried it on clonidine and it looked terrible, or it didn't do anything for the trigger, the dog was just as reactive, or it had diarrhea and vomiting. But in general, I would say it's fairly reliable and low in side effect profile. And if you look at any client that Zoe and I see every day of the week, that would be our common combination, is a SSRI and clonidine to begin. So the clonidine, and we would stagger the start of them. So because the clonidine is going to work fast, I start with that. Which I'm not sure if Zoe does do this, but I should look at her notes. I start with the clonidine first, because within 3 days I've got a clonidine dose sorted, and then I start my SSRI. Because my SSRI is going to take the 6 to 8 weeks to work. I don't have to rush that. I actually want to see the clonidine on its own work. I actually need whatever I'm using adjunct wise, so I call these adjuncts benzo, clonidine, trazodone, GABA, to make the dog look as good as possible before the SSRI has even been put on board. Because if you think about these dogs, you don't want the client living in hell for 6 to 8 weeks while you wait, do you? Because they're either going to kill the dog or, you know, have an injury. It's usually crisis point. So you're going to start some clonidine, and if that doesn't do it, then you're going to add a second adjunct. You might be adding GABA, because why would you do GABA? Come on, Jasmine, you're falling asleep. Are you falling asleep? Why would you add GABA? What do you want? What do you like about GABA? I care about GABA. Which one?
Low side effect.
Low side effect, yeah. Pretty safe. Safe as houses, actually, right? If we use it like we do in behaviour, what you see is they're not dull. And why are they not dull? Because what's out of whack? What have they got too much of? Too much glutamate is what I'm imagining is happening. Too much excitatory chemical load in their brain. Why are they nutcases? Why are they hypervigilant? Why are they spinning around like that? So if I see that, if I see this, right? This is our baseline. This is what I do. This is how I live my life.
So she's only ever done it clockwise today in here. This is something we want to kind of,
I mean,
guess.
a lot of spinners will actually
Is
not
this as
even
fast
spin
as
in
it would be?
console.
No,
But
she's
she's
like,
so
Go
wide that
fast,
she's
isn't
going
it?
to spin.
Oh, there we go, the other way. Okay, so it is both
When
ways.
you won't start with med, like when you want to start just try the training, or is it by the time they come to you, it's
Not in my, it's not in my, not in the cases I get. But you
Yeah,
might.
are there contraindications, like with a certain breed it's not allowed to have one of these drugs or a certain whatever, or nothing that
Well, if you've got other underlying disease states, I mean, nearly all our dogs are young and fit, fit, you know, physically fit. We do always try and do blood work, right? Get a baseline, repeat yearly. Look for liver and kidney issues.
this dog here is under a year of age, right? Of course, that's what they are when they're these bull terriers at sin. But you know, you need to stop this now. This is making your life impossible to repair the longer it does this. So you would clonidine, GABA, you could even throw trazodone, you know, you could have all three going. You need to make it look normal and then put the SSRI on board. And then you can take the others away at some point. I mean, you know, usually if you can't make this look normal, it's gone. It's in its own world.
What's the actual
The
brain issue?
Yeah. So they haven't really. They have likened it to OCD in humans. So obsessive compulsive disorder, but it is probably a. I think of it like the brain has found a mechanism that feels good to do, and then becomes normalized to actually, or to do it feels normal, and then to do it is a requirement of feeling normal. So I've lost control of it. So we call that emancipated from you. If you can find out, sometimes you can identify an original stressor that the dog did it after the stressor, but it's hard sometimes to find that. They start super early if they're genetically predisposed, like the bull terriers seem to be, because they start at 12 weeks. They start super early. So by the time you see them, they've already it feels like no one is home is what it feels like to me. It's very odd.
Is it starts with self-soothe, maybe that releases the serotonin or the dopamine, and then it just becomes so dopamine yeah.
It's addictive. So I call these dogs, to the clients, the crackheads of the canine world, right? But, you know, I don't know if that sits well with them. But, you know, it feels to me like so strongly required to do that you will do it. See, these dogs you don't, I think I've said to you before, you don't physically interrupt them if you can avoid it, because it's like taking their drug away, and they can aggress to you. And that's what this dog did, certainly aggressed towards the owner, interrupting this dog, and eventually that's why she got rid of it. She interrupted it and it grabbed her by the chest.
Archie,
So here she's trying to stop him with her verbal reprimand, which doesn't work anyway. And here, again, the pattern of the behaviour becomes, so for the individual, I think you'll always see that it's the same. So he always did it the same. He always held his flank, suck, suck, suck. So for however many repetitions then. It's like the person counting steps. It's very patterned. It's quite bizarre, isn't it? Fascinating. They are the more fascinating behaviour cases, to be honest. A little bit more and then we'll have lunch, I think. So, obviously you do need to think about serotonin syndrome when you're using serotonin meds, right? You're hopefully never seeing it if you're staying within the guidelines. You should always be drug checking combinations. And you can use human drug checkers like drugchecker.com, right? And you put in your meds, and it'll say trazodone, fluoxetine, moderate chance of serotonin, So
it's a good thing to do, to check meds. Opiates, St John's wort, tramadol, fentanyl patches, they're all things that you want to kind of, Again, very risky things to do are to combine an SSRI and a tricyclic. You know, I had a dog sent to me from Karratha or somewhere, and the vet said, the vet put it on clomipramine and fluoxetine. And it was really, actually it wasn't in serotonin syndrome, but it was very, very lethargic and a bit vomiting. And I was like, you don't combine those. And he was like, yeah, I do. I'm like, no, you don't. It's like, yeah, I do that. He's like, no, you don't. Don't do it. You know, like, it's not what you do. You know, you don't combine with selegiline, which is your cognitive decline med. If you're treating an older patient, say it comes in for anxiety that's developed at 10 years of age, you know, you probably just don't want to start with something like fluoxetine that has a 6-week washout between that and selegiline. Do you know what I mean? If you're thinking that you're ever going to need selegiline in the near future because you're starting to worry about cognitive decline, just don't even start an SSRI.
Is selegiline like Vivitonin?
No, selegiline is Anatril.
Oh, okay.
Vivitonin is incredibly safe. You could use that with selegiline or with fluoxetine. That's just, you know, increases cardiovascular and cerebral blood flow, right? But selegiline is a monoamine oxidase B inhibitor, elevates all of those neurotransmitters, serotonin, dopamine, and noradrenaline. So it is registered for use in cognitive decline. In Europe, the vets use it for all sorts of behavioural abnormalities that we tend not to, because it is not an easy med to use. It has lots of side effects and lots of things that can't be combined with. But if you've got a case where you very much think that this is just cognitive decline, it's good. So, aware of the safe and unsafe combinations, right? I don't use tramadol anyway, to be honest. But I definitely am going to avoid it in any of my behaviour patients, because I just don't want that chance. I think this is a good time to stop for a lunch break.